Hi guys, I'm going to be going over the saliva and stool test with you. You just came into the office and the doctor wanted you to do a saliva and stool test, so this is what I'll be going over. So first off, there is a box that you will be getting handed to, and it has everything in it. It has the paper that we already put the information in on what test needs to be done. So all I need you to do is when you get home and you're done with your samples, make sure you put all your name, your information in this gray area right here. Just this top part has your name and everything. The most important is your name, your phone number, your address, and everything that says in here, your date of birth. And also down here underneath all the information, it says, I completed my samples on, and the day that you put it on. Also make sure you put, if you refrigerated them or frozen them, say yes, or if you haven't, say no. That is the most important, and if you don't do that, I will be getting a fax back and I will have to do that for you, and you will be getting a phone call from me asking you questions, which I don't think anybody likes. So there's that first part. So when you do the saliva test, I'm going to have you read the back of the paper. I'm going to have you read the back of the paper, which states what you can and cannot eat with your saliva or stool test. For saliva, there are some things which I'm going to go over a little bit on what you cannot eat. So what you cannot eat for the first day is chocolate, onions, garlic, vegetables such as cabbage, cauliflower, or broccoli. It is not problematic if less than 1 tablespoon is consumed. So if you only have like a bite of any of this, it is fine. You don't have to do that. Also, you do not want to drink coffee or tea or have any caffeinated beverages in the last 24 hours. If so, then don't do it the night after you get it. Do it the second morning then. And for the stool test, there are some things 3 to 4 days prior to your first stool collection and until the last stool sample has been collected, please avoid the use of all vitamins and minerals, iron supplements, brewer's yeast, antacids, antibiotics, digestive enzymes, antifungals, rare cooked meats, fiber, laxatives, and there are also some more on there that you should read also that you cannot do. I do want to let you know that when you do read the stool sample, it is going to tell you to do the B vials first, which are these 2 blue ones, wait 2 days later, and then do the A vial, which is this pink vial. You do not have to do that. You could do all of them in one stool sample. So just make sure you get them all 3 complete different areas. And watch out for the stool sample, watch out for this pink notice because some of our boxes, they labeled the stool sample wrong, so they put the sticker lower than it's supposed to be. So what you're going to do is you're going to open it. There is a little plastic spoon is what you're going to be taking your stool sample for, and you're going to put as much until that water is almost to the top. So probably like this much stool in there. So they have a good amount of stool for you. Make sure you write down the date that you put it on all your samples also. There's a little date and patient's name. Put your name in there also for these 3. And then I'm going to go over the saliva test with you. So there are 5 saliva tubes. And I'm going to go over 1 each. So the morning fasting one, and it clearly states morning fasting on there. You're going to make sure you put your name and your date of birth on all of these before you get started. So you're going to probably spit in them. For the morning fasting, you're going to get up. You're going to go straight and do this. Don't rinse your mouth. Don't brush your teeth. Don't drink water or eat anything. Just go straight and do this. You're going to fill it up to about 3/4 of the way, so that's probably about right there. You're going to do a noon one after your morning one, a afternoon one, and a midnight one. So the midnight one, you don't have to do at midnight unless you go to bed at midnight. You could do that one like around 10 or right before you go to bed. There is a green one, and I'm going to go over this one. You're going to do it says on the back of the saliva test right here that I was stating earlier, it says it right here, FL pour off vial, which is this green one. So what you're going to do here is it states pour off enough saliva from the noon or afternoon one, which are the blue vials is what they are talking about. And it doesn't matter which one, you could do noon or afternoon. Pour the vial to fill the FL vial to the second line, which it says right here. There are little lines on here that you can't see through there, but it says right here. So you're going to pour enough of this blue vial until you hit the second line of the green vial of the afternoon or the noon one. And then you will, if you exceed more than the line 2, do not pour it back into the blue vial. Make sure all the caps are tight and put them all back into the box when you're done. They all come into little baggies like this, which have a little moist catcher. So you're just going to make sure you put all your tubes back into the bag. Put this back in the box that we gave you, along with this. And all your stool samples also go in a bag and back into the box. And when you're done with that, we have a little sticker inside the box that you're going to go and you're going to put it right on top of the box. And you're going to put your name here. You're going to go to UPS, the nearest one of yours, and you're going to send it out that way. It's already prepaid, so you don't have to worry about paying. The only thing is, if you do put this on the box and say you forgot a vial, you will be paying for it out of pocket to be sending it to the lab. And I believe these are like $13 to $15, I'm not sure. So just make sure you have everything back in the box before you send it out. So like I tell all my patients, what is in the box goes out of the box. So you're going to send everything that is in this box out, except for this. This is going to go on top. And that's it. And if you have any questions, go ahead and call the office at 925-999-8806 or the Fremont office, 510-796-1288. Thank you.